Pag si Myla magsasalita, i-mute ko ha.
Marla, yung wait ka na magsalita, di parang...
Tapos pag malapit na si Myla, i-end ko na para makarinig ka.
Yung next din.
Ganito ha. Ganito ang gagawin ko kay Michelle. Pag si Myla na magsasalita, i-mute ko ng kalahati. Pag sinyas ka sa akin ng ganito, pasok siya.
Nag-grounded kayo. May grounded po.
Okay. Mic test. Mic test. Okay, so I will mute everyone first. Apologize for the technical difficulty. Kindly, I will mute you everyone first. Do not unmute yourself. Okay, so hold on for my instruction. Because I cannot do a recording inside the breakout rooms. So what I'll do is I will transfer the other groups into waiting rooms. So if you are not currently presenting, so I will throw you in the waiting room. Okay. So only the HIV group will be remaining here. Okay, so the rest, please go to the waiting room. You can talk over there. Okay, looks like. Okay, are we recording? Yeah. Okay. Yeah. Who can share the screen? Group 1, get ready. Okay, so we'll give you 20 minutes. We will for the judging criteria, it will be based on content, organization, and the delivery. Okay, so the maximum score is 30 points. So please try to do your best. If there's some IT or microphone issue, just fix it quickly, and then please continue. Just continue, don't pause, right? Continue with your presentation, okay?
Okay, Doc.
Yeah, so by the way, thank you to our guest judge. Our guest judge is Miss Rona Cruz. She's with Dementia Singapore, and she's a program coordinator assistant over there and under the care staff. And she is a trained nurse by training. Ma'am Rona, you want to say hello before group 1 starts?
Hello, everyone. Good morning.
Good
Thank you, Doc,
morning
for this
po.
event again.
Good morning po.
For everyone, wag po kayong kabahan. I know you studied well and you are prepared. So just be confident in presenting your case. Okay,
Thank you.
that's all.
Thank you, Ma'am Rona. We are also doing the recording because another judge will review the recording and will give you score at the same time. Okay, so any question? If not, we can begin. All the best.
Thank you po. Good morning, panels. Good morning, classmates. Before we start our presentation, I would like to introduce our group, the Unshaken Group, and we are from Group 1. Our topic is HIV/AIDS. AIDS is caused with HIV virus. HIV virus is belong to lentivirus group. HIV is silently spread from cities, villages, and towns, and it's now found with all categories of people. It's no longer confined with high-risk group like sex workers, patients suffering with STD. Global HIV and AIDS statistics. There are 30.2 to 45 million people were living with HIV in 2020, and 1.1 million to 2.1 million people became newly infected with HIV in 2020. There are 480,000 million to 1 million people died from HIV, from AIDS-related illness worldwide. Next, objectives.
Objective: to enhance earlier referral to prevention, care, treatment to support of person newly identified as being HIV positive. Increase of awareness of safe practice to prevent HIV infection. Practice safe sex by using latex condom or choose your sexual partner. Life cycle of HIV. HIV attacks to the CD4 cell of the immune system. CD4 cell are type of white blood cells. 7 stage of HIV life cycle: binding, fusion, reverse transcriptase, integration, replication, assembly, and binding. Binding. This is the very first stage of HIV life cycle. Fusion. After the virus has effectively attached itself to the CD4 cell. Reverse transcriptase. The third stage of HIV was the virus has entered to the CD4 cell. Integration, when the virus has successfully entered to the CD4 cell. Replication, the fifth stage of HIV life cycle. The fifth stage of HIV life cycle when it start to form an HIV protein in long chain. Assembly, the sixth stage of HIV life cycle which are now produced by infected CD4 cell. Binding, the final stage of HIV which now the immature HIV is released. Differences of HIV-1 and HIV-2. HIV-1 is the common type of HIV and accounts of 95% of all infections, while HIV-2 is relatively uncommon, less fatal, less infection, and progresses slow down HIV-1. How is HIV transmitted? HIV transmitted by coming directly contact with certain body fluids of the person who has HIV. These fluids are blood, semen, rectal fluids, vaginal fluids, and breast milk. Most common ways by spreading HIV: having another vaginal sex or with a positive person, sharing needles was HIV positive. Less common ways: during pregnancy or breastfeeding, oral sex, receiving blood transfusion are contaminated with HIV, getting stuck with an HIV contaminated. Next, definition and term.
Michelle, I cannot hear you properly. Can you unmute yourself?
Yung ano, headset mo.
Hello.
Hawakan mo yung headset mo.
Okay, better.
Okay. Healthy adults have the CD4 count of 500 to 1,600 per cubic millimeter. And a person with HIV have the CD4 count of 200 below, it will be diagnosed with AIDS. That makes a person living with AIDS is a vulnerable or wide range or illnesses, including pneumonia, tuberculosis, oral thrush, cytomegalovirus or CMV, cryptococcal meningitis, toxoplasmosis, cryptosporidiosis, cancer, including Kaposi sarcoma and lymphoma. Oral thrush is a fungal condition in the mouth or throat. Cytomegalovirus is a type of herpes virus. Cryptococcal meningitis is the fungal condition in the brain. Toxoplasmosis is a brain condition caused by the parasite. Cryptosporidiosis is a condition caused by the intestinal parasite. Cases of HIV progress through 3 stages: acute HIV infection, chronic HIV infection, and then AIDS. Acute HIV infection is the earliest stage of HIV infection. Generally, it will develop within 2 to 4 weeks after the HIV with infection. Some people have the flu-like symptoms such as headache, fever, and rash. Chronic HIV infection, also called as asymptomatic HIV infection or clinical latency. During this time, HIV continues multiply in the body, but at very low levels. Some people with chronic HIV infection may not have any HIV-related symptoms. Age is the final and most severe stage of HIV infection because HIV infection is severely damaged the immune system. Next, sign and symptoms.
Sign and symptoms. Early HIV symptoms generally arise within 1 to 2 months after transmission, although they can arrive as after exposure. Symptoms of HIV are fever, headache, swollen lymph node, sore throat, rash, itching muscle, ulcer in the mouth, esophagus, anus, and genitals. Early symptoms of HIV are fever and chills, swollen lymph node and mouth ulcer, muscle fatigue and age, nausea, vomiting, and a loss of appetite, joint pain, headache, and mood swing, pneumonia, cough with phlegm, shortness of breath and chest pain, high heart rate and low blood pressure, glassiness, rashes, and blueness of the skin, women change in menstruation, lower belly pain, vaginal years infection, later stage of infection. First stage of HIV is known as acute or primary HIV infection. Stage 3 is final HIV. During this phase, the immune system is severely damaged and is vulnerable to opportunistic infection. These symptoms can include nausea, vomiting, fatigue, fever. Symptoms associated with HIV itself, such as virus cognitive impairment, can also become apparent. Other consideration: when the immune system is severely damaged, and when the immune system is impaired, these germs can attack the body, cause illness. Some people did not show symptoms during early stage. HIV may become symptomatic and begin to feel sick if the virus is progressed. Risk factor: having sexual transmitted infection, STIs such as syphilis, genital herpes, chlamydia or gonorrhea, engaging with unprotected anal, vaginal or oral sex, especially with multiple partners or anonymous partners having sex, certain other sexual practice, including oral anal contact and sharing sex toys, carry very low but not zero risk of transmitting HIV. Next, pathophysiology.
It is the study and the structures of our stem cell and the white blood cell. Stem cells are divided into two parts, lymphoid line and myeloid line. Stem cell is the body raw materials from which all other cells with specialized or generative function. Lymphoid line, it consists of those blood cells that begins in a bone marrow in a process called hematopoiesis. T cell, it is one of the most important white blood cells of the immune system and play the central role in adaptive immune response. T cell can be distinguished from other lymphocytosis by the presence of the TCR, T cell receptors. B cell, it is a part of the immune system and developed from stem cell in a bone marrow. Myeloid line, cells in the myeloid cell lines are those and will eventually become become the specific adult blood cell. Macrophage. They are specialized cells with individual in detection, phagocytosis, and destructions of bacteria and other harmful organisms. Basophil. It is a type of the white blood cell and a granulocyte. Mast cell. It is the white blood cell that locate all over our body. Example, our skin, lungs, and intestinal tract. Neutrophils. Most of the white blood cells that leads to the immune systems are neutrophils. It is the most plentiful type of making up to 55 to 70% of our white blood cell. Eosinophils. It is also called eosinophiles or less commonly acidophiles, are a variety of white blood cell and one of the immune system components responsible for combating multicellular parasites and certain infections of vertebrates. Red blood cell, also known as red blood corpuscles, red cell, hematocytes, erythrocytes are the common blood cells that helps in transporting oxygen to our body. Megakaryocyte, it is a large bone marrow cells with lubricate nucleus responsible for productions of blood thrombocytes, which are necessary for normal blood clotting. White blood cells, it is divided into three types: granulocytes, monocytes, and lymphocytes. White blood cell, also known as the leukocytes, are the cell of the immune system that are involved in protecting against both infection diseases and foreign invaders. Granulocytes, the immune cells that has granules with enzymes that are released during infection, asthma, allergic reaction. Neutrophil, eosinophils, and basophils are granulocytes. Monocytes, it is a type of a leukocyte or the blood cell or the white blood cell. They are the largest types of the leukocytes and can differentiate into macrophages and conventional dendritic cell. Dendritic, a professional antigen presenting cell that link innate and adaptive immunity and are criteria for infection and productive immune response against pathogen. Lymphocytes, it plays an important role in our immune system, helping our body fight off infection. Many underlying medical conditions can cause lymphocytosis. Here we have the B cell and T cell again, as we mentioned earlier. B cell is the immune system and developed from the stem cell in a bone marrow, whereas T cell is the most important white blood cells of the immune system that play the central role in our adaptive immune system response. Next.
Diagnosis. Blood tests are the most common way to diagnose HIV. These tests look for antibodies to the virus that the body is creates in an attempt to fight the virus. It can take the body anywhere from 6 years to a year to develop antibodies to the virus. It also can alert you to avoid high-risk behavior that can spread the virus to the others. The primary tests for diagnosing HIV and AIDS includes ELISA test, home test, saliva test, viral load test, Western blood. ELISA test, which stands enzyme link immunosorbent assays used to detect HIV infection. Home test. The only home test approved. The only home test is called the Home Access Express test, which is sold in pharmacies. Of saliva test. Ecotome PET is used to obtain saliva from the inside of your cheek. Viral load test. These tests measure the amount of HIV in your blood. Generally, it's used to monitor treatment. Western blood. This is a very sensitive blood test to confirm positive ELISA test result. HIV infection can be detected 18 to 45 days after an exposure, while the test for blood from finger prick takes 18 to 90 days after an exposure. Next, treatment.
Treatment of HIV are called antiretroviral. Antiretroviral
Wait lang, sir.
therapy
Sir, commit, sir. Sir,
is
live lang.
recommended for everyone with HIV diagnosis. It slows down the growth and replication of HIV. It's also lower the viral loads, which is the amount of HIV in the blood. This medication is not cure for HIV or AIDS. There are several types of antiretroviral treatment. Some of the classes are nucleoside reverse transcriptase inhibitors, protease inhibitors, integrate transfer inhibitors, non-nucleoside analog reverse transcriptase inhibitors, CCR5 antagonists, fusion inhibitors. Prevention of HIV/AIDS. Protect yourself during sex. Protect others if you have HIV. Other HIV prevention method. Protect yourself if you inject drugs. Prevent mother and child's transmission. Taking PEP is to prevent or control the spread of infection disease. How can I prevent getting HIV from sex? Choose little activities with little no risk. Use condom right away if you have sex. Take PrEP to prevent people at risk of getting HIV. Lastly, decide not to have sex. Next, nursing intervention.
We cannot hear you, Aida. We cannot still hear you, Aida. Can you unmute yourself? We cannot hear you, Aida.
This one, Doc.
Yes, you can start.
There is no cure yet for HIV or AIDS. However, significant advance has been made to help the patient control signs and symptoms and impair disease progression. Nursing care plans for the patient that be diagnosed of HIV or AIDS. Imbalanced nutrition. Limit food.
Aida, we cannot hear you. Yeah. Can you check your audio if it's connected properly? Unmute yourself.
Hello?
Yeah, do not move so much, okay? So then your audio won't be affected.
Okay, Doc.
Okay, continue.
There is no acute and chronic pain. Assist pain report, noting location, intensity scale, frequency, and time of onset. Skin impaired skin integrity. Assist skin, daily color, turgor, and circulation. Impaired oral mucous membrane. Document the pen swelling, difficulty of chewing, and swallowing. Disturbed tooth of care. Avoid arguing about patient perception of the situation. Social isolation. Treat with dignity and regards the patient feelings. Powerlessness. Encourage the patient control responsibilities as much as possible. Deficient of knowledge. Provide information about symptom management that complements of medical regimen, interaction, and side effects. Risk of injury. Protect patient from the procedure. Rest of the patient fluid volume. Assist skin turgor, mucous membrane, and thirds. Rest of infection. Assist patient knowledge and ability to maintain the opportunities of infection prophylactic regimen. Next, conclusion.
As we come to conclude, we can say that HIV attacks our body, our immune body. It targets the CD4 T cells of the immune system. The CD4 T cells coordinate the body immune system. There is no 100% cure of HIV. Once if it infected, it lasts for the lifespan of our body. People used to confuse about HIV and AIDS. HIV HIV and AIDS. HIV attacks the body immune system, whereas AIDS is the immune system caused by the highest stage of HIV. It can be controlled by using ART. A person having HIV can be controlled by using ART. Wait, I got it. Look. Okay. It can be controlled by using ART. A person having HIV can be controlled by ART. There is no 100% cure of HIV. Once if infected, it lasts for our lifespan. Some people used to confuse about HIV and AIDS. HIV attacks our immune system, whereas AIDS is the highest illness caused by the virus of HIV. If a person infected, sorry. As we come to conclude, we can say that the human immunodeficiency virus HIV works in our body by attacking the immune system. It targets the CD4 T cells of the immune system. The CD4 T cells coordinate the body immune system. It can be controlled by using ART. A person infected HIV can get the life for 8 years with HIV if it get controlled by ART. Some people used to confuse about HIV and AIDS. HIV attacks the body immune system, whereas AIDS is the highest illness caused by the immune system of HIV. There is no 100% cure of HIV. Last but not the least, we can say that prevention is better than cure. Thank you.
Thank you very much. I will just stop the recording. So again, good morning to everyone. Welcome to our case presentation. We are now on group 2. So group 2 will be presenting on ischemic heart disease. But before we start, let me introduce one of our guest judge. That's Ma'am Rona Cruz. She's from the Dementia Singapore. She's the program coordinator, assistant over there, and she's a part of the care staff. Ma'am Rona, you want to say a few words?
Hello, good morning, everyone.
Good morning.
Just relax and be confident in presenting your report, your case. So good luck. God bless. Thank you, Doc.
Thank you, Ma'am Rona. So we are recording this presentation so that another judge can also view this on another time. Okay, so again, you have 20 minutes. Good luck. You can begin.
Hello, everyone. Before anything else, I would like to introduce myself to you and my co-members. By the way, I'm Dino Villacaro. I'm Brenda Marti Donasco. I'm Maria Lardy Duwit. I'm Isabel Sebastian. I'm Yesa Beatriz. I'm Excel Lago. I'm Laipinal Antonio. Today, we will present our research paper entitled Ischemic Heart Disease. The outline of this presentation were as follows: the objective, the introduction, the objective, definition, the pathophysiology, the signs and symptoms, the diagnosis, the treatment, the nursing intervention, and the last but not the least, the conclusion. So to start with, I will give the floor to Ms. Isabel to present the introduction and the objectives.
Thank you, Ms. Dina. Okay, let's proceed to the introduction and objectives of the study. This case study addresses cardiovascular disease, a focus focus on a deep understanding and analysis of the nature and other necessary knowledge about ischemic heart disease. The aim of this study is to understand the different ideas and concepts of IH. Objectives: determine pathophysiological nature of IHD, determine signs and symptoms and other risk factors of IHD, determine and discuss the definition of IHD, determine and apply different ways in order to prevent IHD, determine the different methods of diagnosis of IHD, determine natural and scientific treatment of IHD, determine and develop the different nursing intervention and healthcare in handling patients that has IHD. May I call the Army for the definition? Thank you, Isabel. Now, I'm discussing to you the definition of ischemic heart disease. These chapters describe the evaluation and management of ischemic heart disease, which evolved significantly over the past decade. In particular, several clinical trials have documented the benefit of revascularization in patients with acute ischemic syndromes, as well as the efficacy of medical therapy, including life modification in patients with stable coronary disease. Ischemic heart disease is a condition of recurring chest pain or discomfort that occurs when a part of the heart does not receive enough blood. This condition requires greater blood flow. Ischemic heart disease, also called coronary heart disease, and is a leading cause of death worldwide. Ischemic means that an organ, a heart, is not getting enough blood and oxygen. It is the term given to heart problem cause of narrow heart coronary arteries that supply blood to the heart muscle. Ischemic heart disease may lead to severe heart damage, can result a heart attack and shock, and maybe life-threatening. That's all. Now we proceed to pathophysiology. May I call Jessa? Pathophysiology is a convergence of pathology and physiology. That means the study of disordered physiological process that cause results from associated with a disease or injury. According to the conventional ischemic heart disease, pathophysiological point of view, an obstructive plaque that inhibits blood flow through the coronary artery, triggers myocardial ischemia. Coronary artery disease is defined by the presence of obstructive atherosclerotic plaque, which causes a blood flow reduction to myocardium. This culprit stenosis presents the final stage of the complex atherosclerotic process. The latter is mostly associated with contemporary lifestyle. When you have ischemic heart disease, you may suffer inflammation, coronary microvascular dysfunction, atherosclerotic, and vasospasm. Inflammation may promote the growth of plaque. Coronary microvascular dysfunction refers to abnormal dilation and contraction of the small blood. Atherosclerosis is a disease that occurs when plaque builds up inside artery. Vasospasm is the narrowing of the arteries caused by a persistent contraction of the blood vessels. All in all, is determined by imbalance of phase top between myocardial energy. State coronary blood flow. This is due to several conditions, particular conditions, the complex pathologies of ischemic heart disease. That's all, and thank you, and may I call on with Excel to present the signs and symptoms.
Thank you, Ms. Jessa. Okay, let's proceed with the sign and symptom. Chest pain is typically on the left side of the body and angina pectoris, caused when your heart muscle doesn't get enough energy. It may feel like pressure or squeezing in your chest. The discomfort also occurs in your arm, neck, back, or your jaw. Shortness, lightheadedness, or pain relieved by waste of medicine. May it feels as a pain starting in the chest, spread to the arm, back, or other areas. Extreme fatigue occurs when the muscles work harder, usually is physical exertion. Weight gain is an increase in the body weight. This can be either increase in muscles, mass, fat deposits, or excess fluids such as water. Heart palpitations, heaving or fast breathing, fluttering, or pounding heart. Difficulty for sleeping occurs when a person has trouble falling asleep, staying asleep. Dizziness, lightheadedness, or fainting, a false sense of spinning, unsteadiness, feeling of floating or swimming. Swelling in your leg and feet known as edema. It mostly occurs in the feet, ankles, leg, or in hand. Swelling caused by fluid retentions. Swelling in your abdomen is a general condition in which the abdomen distended or enlarged, associated with sensations of fullness, bloating, stretching, or pain, and an overall girth. Causes cough or causes caused by fluid in your lungs. Pneumonia also leads by fluid, built up in a tiny air sacs in your lungs, but it caused by infections with a virus, fungus, bacteria. Symptoms include chest pain. That's it. May I call Dinah to continue the diagnosis?
Thank you, Ms. Edson. Now we will proceed to diagnosis. Diagnosis is the test to discover any disease. These are the diagnostic tests that we are applied to determine ischemic heart disease. First, clinical assessment. Clinical assessment is the evaluation of pain characteristics, age, gender, previous cardiovascular morbidity, and other risk factors are the basis for the assessment of probability of IHD. Second is the ECG. ECG is the electrocardiogram. ECG is a sample test to use to determine is a sample test to check your heart rhythm and the clinical activity. Third is the biochemical test. Biochemical test is a curious, widely ranging mixture of clinical art and science with clinical chemistry. The term biochemical refers to emphasize the biologic nature of the enzymes and chemical present in the human body. Fourth is the exercise stress test. Exercise stress test is an exercise used to determine how well your heart responds with its working heart. It also used to help your doctor to determine if your heart received enough oxygen and proper blood flow. Fifth is the gender exercise stress test. A gender exercise stress test is a test wherein generally based on the gender, which means for the boys is more vigorous compared to girls. Number 6 is a myocardial perfusion. A myocardial perfusion is a well-validated method for the investigation of myocardial perfusion. This test is done to show how well your blood flow into the heart muscles. The last but not the least, the coronary CT angiography. The coronary computed tomography angiography is an imaging technique during which iodinated contrast dye is injected through a peripheral vein. It is mainly used to check the narrowed or blocked arteries. Okay, that's all for diagnosis. So may I call Ms. Brenda to present the treatment.
Thank you, Ms. Diana. For treatment on IHD, so depend upon the diagnosis of the patient. Either a drug treatment, angioplasty, and stent placement, or a bypass surgery. Drug therapy is commonly used for treatment of IHD includes the following. Angiotensin, it is a drug converting enzyme inhibitors which relax the blood vessels and lower blood pressure. Number 2 is anti-ischemic agents such as ranolazine or Rexana. Ranolazine is a novel agent that inhibits the sodium current, thereby reducing cellular sodium and calcium overload and has been shown to reduce ischemia in a patient with chronic stable angina. Number 3 is antiplatelet drugs, which prevent the formation of blood clots. The very common of this drug is aspirin. Number 4 is beta blockers, which lower the heart rate. These blockers are a class of medication that are predominantly used to manage abnormal heart rhythms and to protect the heart from a second heart attack after a first attack. Number 5 is calcium channel blockers, which reduce workload on the heart muscles. They work by preventing calcium from entering the cells of the heart and arteries to speed more strongly by blocking calcium. Calcium channel blockers allow blood vessels to relax and open. Number 6 is nitrates, which dilate the blood vessels. The very common of these drugs is nitroglycerin. Number 7 is statins, which lower cholesterol. In drug procedure, there are 2 procedures that used to treat IHP. Number 1 is angioplasty and stent placement. This procedure is to remove leg and restore blood flow and clog arteries. The second is coronary bypass. Is coronary artery bypass. This procedure is to help restore the blood flow in the heart by routing the flow through transplanted arteries. That's all for the treatment, and we will proceed to nursing intervention by Ms. Lightning.
Thank you so much, Ms. Brenda. So what is nursing interventions means? Nursing interventions is a nurse action that takes place to implement patient care plan, including treatment procedures and medication. So when the patient is suffering from acute pain, they may feel, as a nurse, we must assess pain location, gradations, durations, occurrences, and a new phenomenon. Assess of signs of hypoxemia, give oxygen therapy if necessary. Check vital signs during period of illness. Decrease cardiac output. As a nurse, we must maintain bed rest with head elevations of 30 degrees during the first 24 to 48 hours. Assess and monitor vital signs and hemodynamic per 1 to 12 hours. Unshaking. As a nurse, we must assess signs and verbal expressions of unshaking. Accompany patient during period of high unshaking. Provide an explanations of procedures and treatment. Activity intolerance. As a nurse, we must encourage the patient physical activity, develop proper patient exercise programs. Evaluate patient's recovery, speed between sessions to ensure proper scheduling and prevent additional overload of stress when the patient is still recovering from previous sessions. Deficiency knowledge. As a nurse, we must discuss pathophysiology of condition stress for preventing and managing angina attack. Review significance of cholesterol levels and differentiate between LDL and HDL factors. Emphasize importance of period laboratory measurements. Remember that some of the interventions can need a doctor's guide and some are not. May I call Ms. Larnie to represent the conclusion?
Thank you, Lajmel. Now we proceed to discuss the conclusion. Out of drug understanding in true research about ischemic heart disease, the researchers conceptualized the following conclusion. Ischemic heart disease occurs as a result of multiple altered regulated vascular pathways that include severe atherosclerosis, just in some cases. Ischemic heart disease pathophysiology is complex and multifaceted, and a panoramic overview about its current paradigms. As a large of patients with ischemic heart disease have minimal or no epicardial coronary vascular disease. On an individual level, coronary heart disease continues to take a toll on the numbers of lives lost and on the life of poor survivors of cardiac arrest. The economic burden to the individual and to society will continue to grow unless the disease is controlled or prevented. Coronary heart disease is chronic and multifactorial disease. As hundreds of complex signal pathways are contained in coronary heart disease formation, it is important to construct a biological network and protein database about ischemic heart disease. In this view, we not only compile coronary heart disease related signal pathways and protein database, but also provide a comprehensive knowledge of drugs, tests, and their application in the clinic for the treatment of coronary heart disease. As the protein database includes protein database includes potential drug targets for the treatment of coronary heart disease. It may help a drug discovery in the future. With the development of drug discovery, I can be anticipated that more and more efficient medicinal solutions will be applied in clinic for treatment of coronary heart disease. That's all. Thank you, my call Dinah.
Thank you, Ms. Laardi. So may I call everyone to go in front? That would be all. So the floor is open for any recommendation, question, and clarification. Thank you so much.
Thank you very much. Let me just switch off the recording. Good morning. Welcome to this case presentation. This is group 3. They're going to present breast cancer. You have 20 minutes, but before that, let me quickly introduce our guest judge, Ma'am Rona Cruz. She's from the Dementia Singapore, and she's part of the care staff and working as a program coordinator assistant. Ma'am Rona, want to say a few words?
Hello, good morning, everyone. So we are going to talk about breast cancer, and I think most of us will be we are all female, diba? So I hope it will be delivered properly and understandable to everyone. And let's see your nursing interventions later. Okay, good luck. God bless.
Thank you very much. Again, this is recording to be reviewed by another judge. If you are ready, you can begin, and all the best. Good luck.
Good morning, everyone, panelists and group mates. I'm Elisa Hayag, and we are the group 4, the breast cancer fighters.
Breast cancer fighters.
Breast cancer objectives. At the end of this study, we are able to, first, determine what is breast cancer. Second, identify the signs and symptoms of breast cancer. Third, gain more knowledge about the causes and risk factors of breast cancer. Fourth, know the types of breast cancer and its treatment accordingly. And last, educate the people about the importance of self-examination from time to time.
You are muted, Mary.
Sorry po. Good morning, everyone. I'm Mary Ann Vargas, breast cancer definition. Breast cancer is disease in which malignant cancer cells forms in the tissues of the breast, an array of abnormal cells which follows an abnormal of contour as they lost their growth pattern. It has two major categories and types according to its categories. Two major categories of breast cancer: invasive and non-invasive breast cancer. Invasive breast cancer spreads from the lobular gland or ducts to the rest of the breast. Non-invasive breast cancer have not spread from the root cells, stays within the milk duct or lobules in the breast.
Good morning, everyone. Panelists, I'm Rema Katubag, Pathophysiology of Breast Cancer. A cancer is formed when a certain cell in the body develop one or more mutations that allow them to grow and divide. Factors the normal cell within cancer. There may be cancer cells with different mutations that lead to the evaluation of new cancer behavior over time, including different areas of cancer, spread which is called tumor heterogeneity. Breast cancer happens of some factors and when the changing of structure of gene, also known as mutation, occur that regulate breast cancer cell growth. The mutation process, the cell is an exponential rate. The cell keeps expanding, replicating its predecessors that get progressively more abnormal. These flowcharts best describe how breast cancer occurs, discussed by Jezebel.
Good morning, everyone. I am Jezebel Cervantes, presenting to you the breast cancer risk factors of breast cancer. Cancerous abnormalities of the breast cancers occurs in two types of tissues, the ductal epithelium and lobular epithelium. The spectrum of proliferative abnormalities and breast cancer. Hyperplasia, atypical hyperplasia, and cytocarcinoma, invasive carcinoma. Invasive ductal variants, mucinous, acinoid cystic tubular. Ductal epithelium, 85% to 90% invasive carcinomas. Lobular epithelium, 10% to 15% invasive carcinomas. Lobules, ducts, nipple, areola, and fat. Risk factors of breast cancer. Heredity, reproduction, gating period before and after menopause, hormone replacement therapy, infertility problem, alcohol intake, oral contraceptive, using for a long time, rejection of factors, history of breast cancer condition, body mass, physical activity, and diet.
Good morning, everyone. I'm Nubi Paul for sign and symptom of breast cancer. Lump in the breast. Visible change of the breast such as swelling, puckering, redness or inflamed, retracted nipples, flaky skin, and orange peel-like appearance of the skin of the breast. Discharge from the nipples. Swollen lymph nodes, breast pain. It may also include insomnia, fatigue, shortness of breath, and digestive problem. An unusual discharge from one or both nipples. Constant pain in armpit or in one part of breast. A change in the color of the breast may look red or inflamed. A puckering of the skin of the breast. Crusted or flaky skin or a rash around the nipple. Change in shape or in size in one or both breasts. An unusual increase in the size of one breast. Nipple becoming irregular in shape or sinking into the breast.
Good morning, everyone. I'm Sheila for diagnosis of breast cancer. A new breast symptom should be evaluated using triple tests. Physical examination. Self-examination after monthly menstruation through circular motion. As you can see, this is the easiest way to detect the early breast cancer. Just put up your hands and underneath you have to do the circular motion all throughout to your breast and to your nipple. Mammography. Breast compressed between two metal plates and uses ionizing radiation to create a dimensional picture. Breast ultrasound. It is common and no radiation needed. This is a painless test using probe in the breast, which is based on detecting sound waves. Magnetic resonance imaging, or what we call MRI. The woman lies on her front within a scanner with the breast in cup underneath her. Even the tiniest cancerous tissue will detect. This is a powerful imaging tool to detect breast cancer. Breast biopsies. This is done a small operation under general anesthetic by a surgeon, and it's called open surgical and using needle or syringe. Thank you. Judy, your turn.
I think she's mute.
No, she's not.
She's speaking but cannot hear.
We cannot hear you.
June, please unmute.
Hindi siya nakamute.
Junie, we cannot hear you.
June, hello.
Junie, we cannot hear you. Junie.
Can you try again? We cannot hear you.
Use your headset. We cannot hear you, Junie.
June, hello. Do you have your headset? Please use.
We cannot hear you. We cannot hear you, Junie. We cannot hear you.
Use your headset. We cannot hear you. Can you use headset, Junie, please? Use headset. We cannot hear you.
We cannot hear you. Can you hear us now?
Use your earphone. Can you try to talk?
Can I do it, Doc?
Who's next?
I'm with Junie, Doc, for treatment.
Sure.
Treatment of breast cancer. All breast cancer treatments have two main goals. First, to rid your body as much of the cancer as possible. Second, to keep the disease from coming back. Surgery. First is to take out the tumor. On the operation called lumpectomy, removes only the part of your breast that has cancer. It's sometimes called breast conserving surgery. In a mastectomy, by removing the whole breast. Radiation therapy. This treatment uses high energy waves to kill cancer cells. Doctors also highly recommend this method if the disease has spread. It helps destroy any cancer cells that the surgeon couldn't remove. Radiation can come from a machine outside your body, or you might have tiny seeds that give you off radiation placed inside your breast where the tumor was. Chemotherapy uses drugs to kill any cancer cells. You can take the medicine as pills or through an IV. People get it after the surgery to kill any cancer cells left behind. Doctors also prescribe it before the surgery to make the tumor smaller. Chemo works well against cancer, but it can also harm healthy cells. Hormone therapy uses drugs to prevent hormones, especially estrogen, from fueling the growth of breast cancer cells. Some types of this therapy works by stopping the ova intensine, making hormones either through surgery or medication. Targeted therapy. The medicine target breast cancer cells that have high level of a protein called HER2. TDM1 or adrucizumab emtansine is a medicine that combines Herceptin and the chemotherapy medicine emtansine to target HER2 positive cancer cells. Some are often used with an aromatase inhibitor or fulvestrant in a woman with certain types of advanced cancer. Immunotherapy uses your own immune system to target cancer.
Good morning, everyone. I am Lemma Izwali, nursing intervention of breast cancer. Be empathetic, administer analgesic, perform comfort measure, repositioning the patient, provide skin care, watch for treatment complication, instruct the patient how to manage adverse effect of treatment, monitor patient nutritional intake, monitor patient pain level and efficiency of administer analgesic and non-pharmacologic measure, assess the patient family's ability, especially if the cancer is terminal.
Definition. This is conclusion.
Yes, you can proceed.
Sorry, I lost my connection. Okay, conclusion, the breast cancer conclusion. Breast cancer can be tough and deadly, but also an opportunity to evaluate the whole body's health. But also an early detection of the first cancer means treatment is easier than more likely to be successful. An important role to follow up the problem is to problem may arise that treatment used. They must also have a care plan to maintain checks balance to avoid reoccurrence after the treatment. Therefore, we conclude that having a full understanding about breast cancer, its signs and symptoms, causes and its prevention are beneficial to help patients suffering from it and may enable to ease their stress through encourage empathy and constant communication to motivate them to fight for it. Thank you.
Yeah, since we still have time, Junie, can you hear us? Still cannot. Still cannot hear you. No, I think you're, yeah. Have you?
June is Miss Catherine, madam. So there's something wrong with her connection.
Yeah, no, but I can see her. She's opening her mouth, but there's no audio. No, we cannot hear you. Yeah, no, nothing. Yeah. Anyway, we don't want to waste time. So we will open the Q&A. Once you have audio and we can hear you, Junie, let us know. We will just take note of this. Okay. Yeah, we cannot hear you, Junie. Yeah, unfortunately. Yeah. Okay. So I'll stop the recording. Good morning to everyone. Welcome to the case presentation of lung cancer. I'm Dr. Eugene, and I'm with Mom Arona here, and she's from the Dementia Singapore. She's part of the care staff and working as a program coordinator assistant. Okay, so before we begin, maybe a few words from Mom Rona to this group.
Morning, everyone. Good luck into your presentation. I know you're all prepared, and just relax and be confident in presenting your case. That's all. Thank you, Doc.
Thank you, Ma'am Rona. And again, we are recording this because another judge will review this. So please relax and all the best. Good luck. Your time begins now.
Good morning, everyone. We are the achievers from Group 4. We are going to present our topic, lung cancer. I'm Isa Angelica Benafe, and I'm going to discuss the general objectives and the introduction of lung cancer. General objectives. Lung cancer was in many ways disease. Women who smoke were shown to be almost twice as likely to get lung cancer as male smokers. With this case study, we will find out what are the different types of lung cancer, causes of the disease, symptoms, prevention, treatment, and etc. to be able to know that smoking is the #1 cause of lung cancer. And to recognize other causes of lung cancer, such as secondhand smoke, which are exposure in our homes, various noxious environmental and occupational exposures. Introduction. Lung cancer is a disease that starts to spread and grow out of control. It begins in the lungs and will spread in the other parts of the body, such as brain. Smokers have the highest risk of developing lung cancer. The risk of lung cancer increases with the duration and number of cigarette smoke that forms in tissues of the lung, usually in the cells that line the air passages. It is the leading cause of lung cancer death in both men and women. The definition would be discussed by Ms. Saliente. Ms. Saliente.
Good morning, everyone. I'm Cherilyn Saliente. Today, I will be discuss the definitions of lung cancer. Lung cancer is also known as a lung carcinoma. Lung carcinoma is the malignant tumor derived from epithelial tissue, one of the 4 major types of cancer. Lung cancer is the most common cause of cancer-related death. Lung cancers origins in cells of the lung but can spread to the other parts of the body. Cancers of other tissue can spread to the lungs, impairing lung function, but this cancer would not be classified as a lung cancer. These are some risk factors associated with lung cancer that are difficult to avoid, such as air pollution, exposure to radiations. Individuals who have gotten radiation therapy for breast cancer or certain blood cancer have an increased risk of developing lung cancer. Lung cancer risks are higher if these patients also smoke. People who have had lung cancer in the past are at higher risk of getting lung cancer again. Individuals with family members who have had lung cancer are also at risk also at risk with familial lung cancer. Signs and symptoms will be discussed by Ms. Sukalit.
Hi everyone, good morning. I'm Ms. Vanessa Sukalit. I will discuss to you about the sign of symptoms of a lung cancer. Lung cancer can vary and may not be appear directly related to a lung function. Sometimes lung cancer does not cause sign or symptoms. It may be found at chest x-ray and another conditions. And are the sign of symptoms: chest pain or discomfort, weight loss, shortness of breathing, coughing, spitting of blood, arm and shoulder pain, fatigue, and hoarseness. When symptoms do appear, they can be difficult to diagnose. It may be produce generalized symptoms. Cigarette is the number one risk factor of a lung cancer. And also personal family history of a lung cancer, that there is a risk that you may develop. Your risk of a lung cancer may be higher if your parents and brothers or sisters and children have a lung cancer. Pathophysiology will discuss by Ms. Taberna.
Sorry, nakamute. Good morning, everyone. I'm Gracia Lantaberna. Today, I will discuss about lung cancer pathophysiology. Pathophysiology is a very complex and incompletely understood. It is hypothesized that repeated exposure to carcinogen, cigarette smoke, and particular leads to dysplasia of lung epithelium. This is exposure and continuous. It leads to genetic mutation that affects protein synthesis, and it is disrupts of cell cycle to promote carcinogenesis. Normal lung tissue is made up of cells that are programmed by genes to create certain size and shape to promote certain function. A single lung epithelium or gland cell to trachea bronchial airways is damaged through binding to the carcinogenic chemical to the cell DNA. A cellular change is occur and abnormal cell growth to malignant cell. A damaged DNA is unstable to process two changes on a daughter cell. Lung cancer pathophysiology is also known as solitary nucleus to baroreceptor signals activates that parasympathetic and inhibit to sympathetic pathways. Activation through the vagus nerve to parasympathetic response to SA node and AV node. Inhibition through the spine go to sympathetic chain through the SA node, AV node, and the blood vessel. The net effects of parasympathetic activation over to sympathetic is 1. Bradycardia due to a vagus effect to an SA node, and number 2 is hypotension due to an inhibition to sympathetic pathways which control the vascular tone. A baroreceptor is located to a carotid bifurcation. Baroreceptor sends signal to solitary nucleus in medulla via glossopharyngeal nerve is response to stress and high pressure to medulla. There are two types of lung cancer. First is small cell lung cancer. Small cell lung cancer is an occur and exclusively heavy smokers that less common than non-small cell lung cancer. It is prognosis and present late with disease that has spread. Histological small cell lung cancer is characterized by the scan to cytoplasm and no distinct nuclei. Small cell lung cancer is usually smoking. It is higher doubling type and metastasized early. It is the most aggressive and less common type of lung cancer. It has spread elsewhere in the body. It usually found in smokers and farmer smokers. Number 2 is the non-small cell lung cancer. Non-small cell lung cancer is an umbrella term to several types of lung cancer that behave in similar way. Includes squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. There are 5 types of non-small cell lung cancer. First is squamous cell carcinoma. It is characterized by the presence of intracellular bridge to keratinization. Number 2 is adenocarcinoma. It is the most common smokers in women to non-smokers. Number 3 is adenosquamous carcinoma. It is comprises 0.4% to 4% diagnosed non-small cell lung cancer. Number 4 is large cell carcinoma. Lack of differentiation of cell of small cell and glandular to squamous cell. Number 5 is carcinoid. Includes tumor, two subtype, and atypical and atypical. Atypical carcinoid carries relatively better prognosis, is only occasionally associated with syndrome. The next diagnosis will be discussed by Ms. Lapides.
Good morning, everyone. My name is Catherine Lapides. Today, I will discuss the diagnosis. Essential diagnosis of lung cancer can involve the physical exam and personal history of patient using tobacco. Screening, it's the important to catch lung cancer as early as possible. We have 9 types of diagnosis to undergo treatment if lung cancer is found. First, physical examination. When lung cancer is suspected, the physical will be performed through history and physical exam. Second, chest x-ray is usually the first test performed to evaluate any concern based on careful history and physical. Third, CT scan. Frequently, the second step either to follow up between the abnormal chest x-ray finding to evaluate troublesome symptoms, and those will be abnormal chest x-ray. 4, lung biopsy is lung cancer is suspected in imaging studies. The next step is to have a lung biopsy done to determine or not the abnormality of lung is truly cancer if to determine the type of lungs. Bronchoscopy, a lung specialist insert the tube into scope into the airways and visualize a tumor. 6. Endobronchial ultrasound is a relatively new technique for diagnosing of lung cancer. 7. Thoracentesis. When the lung cancer has fluid and build up between mediastinoscopy is done the operating room under general anesthesia. 11. Test. Non-diagnosis tests are frequently
Okay, we can proceed to the next topic.
Good morning. My name is Marjorie Hapitana and I will discuss about the treatment. Lung cancer treatment depends on the type and the stage of the cancer and involves a combination of surgery, chemotherapy, radiation, and immunotherapy. Surgery is a curative in a very small number of patients. Chemotherapy, alone or combined with the radiation, may be used before or instead of surgery in treating lung cancer. Radiation can be used as the main treatment for tumor that cannot be surgically removed. Immunotherapy. This personalized medicine requires genetic testing tumor determine if they can They can be they can be treated with drugs targeted specifically for them. This poor con- this poor co- this poor combination treatment may be used to treat non-small cell lung carcinoma in general. Stage 1 and stage 2 cancer is localized to one part of lung only. Sometimes, after surgery, further chemotherapy may be recommended to reduce the change of the cancer from returning for patient with stage 3. Lung cancer where lung, stage 3 lung cancer, where the cancer may be large at 7 centimeter or have spread to the lymph nodes between both lungs. Combination of chemotherapy and radiotherapy to the lungs may be recommended for stage 4 lung cancer, where the lung cancer have spread to the other part of lung, and or body further test of the biopsy specimen to subtype chemotherapy or targeted therapy with specific tablets will be more suitable. Nursing intervention and conclusion will be discussed with Ms. Ariola.
Nursing intervention. Don't smoke. Quitting from smoking reduces the risk of lung cancer. Exercise regularly. Drink more water, fresh air, eat healthy foods. Physical activity not only keep weight down or and reduce stress, but also keep hormones level balanced. Conclusion. It will be worth it and renew you. We hope that the case study that we provided has left you in no doubt that smoking is bad in our body that will cause of lung cancer. It may kill you if you continue with it, and it's a choice of murder weapon. It's extensive cancer of pretty much any organ you care to name. Heart attacks, stroke, and the long, slow, lingering death of a chronically suffocating lungs diseases. People with lung cancer need willpower. It's never too late to stop, and there have never been more effective ways to help you try than are available now. But it will be one of the best things you ever do. It will extend your life, improve its quality, and give you more time to spend with those you love. In behalf of my group mates, we wish you all the best as you take your first step towards a smoke-free future. Live each day if it is your last. This is the end of our presentation. Thank you.
Thank you very much. You still have maybe a few minutes. Can I call Catherine? Can you hear me? You're muted.
Yes, Doc.
Yeah, and don't bite your microphone.
Sorry.
Yes. Can you continue if there's a missing part, right, in your presentation?
Yes, sir. Yes, Doc. Blood tests certain the blood test can detect the biochemical abnormalities caused by lung cancer and can also suggest the spin of the tumor. Okay. The treatment will be discussed of Ms. Hapitana. Sorry for the. Thank
No
you, Doc.
worries. Yeah, thank you very much. Okay, I will stop the recording. Congratulations. Good afternoon to everyone. Welcome to our afternoon session for the case presentation. So we will begin with urinary tract infection. You have 20 minutes, and at the end of 20 minutes, we will have a Q&A session. Okay, so you can start. All the best. Okay, kindly unmute yourself, the group one, the first presenter.
Hello. Mic test.
Yes,
Is it I'm clear?
you can start.
Okay, thank you. All right. Good afternoon, everyone. We are the Gold Diggers, and I'm Miss Ronaldine Guanzon, and here to present our case study about urinary tract infections. I will discuss to you the objectives and the introduction. Objectives: to understand the causative of urinary tract infections, to know the risk factor, to study the symptoms of urinary tract in different ages and in pediatrics. To do that, to do the useful investigation, to outline the treatment strategies, to know how you prevent urinary tract infections. Urinary system, also known as a renal system or urinary tract, consists of kidneys, bladders, ureters, and urethra. The urinary tract is a body drainage system of eventual removal of urine. Urinary tract infections is an infection in any part of your urinary system. Your kidney, ureters, bladders, and urethra. The most infections involved in the lower urinary tract is bladder and the urethra. The kidney is to upper urinary tract. Urinary tract infection that affects parts of the urinary tract. When affects the lower urinary tract, it is known as a bladder infections. And when it affects in upper urinary tract, is known as a kidney infections. Some symptoms from lower urinary tract is a kidney and a kidney that will be discussed later. However, during urination is passed from the bladder to the urethra to the outside of the body. Normally, in a healthy human, the urine that they can produce every day is about 800 to 2,000 millimeters. This amount varies according to fluid intake and kidney function. Other neighboring organs and structures, which may not be part of urinary system, also impact on urinary function, in particular, the genitalia. And therefore, the term genitourinary system is often preferred automatically. The urinary tract can be divided broadly into upper and lower parts. Now, we proceed to the parts of urinary tract and the definition, and that will be discussed by Ms. Alvarez.
Thank you, Ms. Goodson. Good afternoon, everyone. This afternoon, I will discuss the parts and definition of urinary tract infection. The urinary tract infection comprises into four main parts: the kidney, the ureters, the bladders, and the urethra. Kidney are ovoid, often referred as bean-shaped, reddish-brown organ located on the other side of the upper abdomen and the posterior abdominal wall. It lies behind the peritoneal cavities and surrounded by fats, which serves to protect it. Kidney has about 10 centimeters long, 5 centimeters wide, and 2.5 centimeters deep. Kidney has a concave medial margin and convex lateral borders. The medial margin is the central cliff, or known as the renial hilum, whereas the blood vessels, nerves, and the ureters are inter or exit the kidney. Next is the ureters. Ureters are narrow muscular tubes that are about 25 to 30 centimeters in length. It is continuous with the apex of the renial pelvis and carries urine formed in the kidney to the urinary bladder. The ureterus crossed over from the abdominal to the pelvic cavities and run short distance into the urinary bladder. Third is the urinary bladder. The urinary bladder is a hollow organ that is shaped like a headrail. It resembles an inverted
We cannot hear you. Anyone?
back surface and lucid, which is closely related to the reproductive system.
Go ahead.
Cannot hear, sir?
Can hear. Go ahead.
And the vagina technique of
We go to the next group first after Annalyn. You are muted. Kindly unmute yourself before talking.
Hello, everyone.
okay, Doc,
I'm
already.
Marjorie Pinion.
Are you okay now, Annalyn? Can you try again? Otherwise, yeah.
Yes, Doc, I'm okay now. Next is the urethra. Urethra is the narrow tube that extends from the neck to the bladder of the relative orifice in men and women, where the urine can spill out into the environment. It varies significantly in length, some 20 centimeters in men and 4 centimeters in women. Urethra is also known as the narrower, while the failed urethra, due to the length and the anatomical courses, can be divided into three parts: the prostatic urethra, the membranous urethra, and the spongy urethra. What is urinary tract infection? Urinary tract infection, or UTI, it is a symptomatic bacterial infection within the urinary tract. This includes the upper urinary tract infection, or acute pyelonephritis, and the lower urinary tract infection, or ascites. This definition is based upon the grouping of symptoms, where, however, the bacterial infection may extend beyond suggested by terminology. Urinary tract infection is usually a bacterial infection can affect the urinary tract, and that's always nearly caused by bacteria, especially Escherichia coli. Next, the signs and symptoms will be discussed by Ms. Penyan.
Thank you, Ms. Alvarez. Hello, everyone. I'm Marjorie Pinion, and I'm going to discuss the signs and symptoms of the urinary tract infection. The classic symptoms of the urinary tract infection includes the burning sensation whenever you pass the urine and the urge to pass urine frequently and urgently. Accompanying symptoms are related to bacterial infection and may indicate a more serious kidney infection. This includes fever and chills, lower abdominal pain, lower back pain, discharge, cloudy and bloody urine, painful urination or dysuria, frequent urination or frequency, frequent nighttime urination or nocturia, suprapubic pain, malodorous urine, and hematuria or the presence of blood in the urine. Signs and symptoms that involves the infection of kidney or the pyelonephritis includes back pain and flank pain, high fever, shaking and chills, and nausea and vomiting. Signs and symptoms that involves the infection of the bladder or cystitis includes pelvic pressure, lower abdomen discomfort, painful and frequent urination, and blood in the urine. Signs and symptoms that involves the infection of the urethra or the urethritis includes the burning sensation during urination and discharge. And now I'll pass you to Ms. Alilin for the pathophysiology of the urinary tract infection.
Thank you, Ms. Pinion. Good afternoon, ladies and gentlemen. I'm Jennifer Alilin. I will be discussing the pathophysiology, a portion of the pathophysiology that is the risk factor and the pathogenesis. Pathophysiology, the urinary tract from the kidney to the urethral meatus is normally sterile and resistant to bacterial colonization despite frequent contamination of the distal urethra with colonic bacteria. The major defense against UTI is complete emptying of the bladder during urination. Other various mechanisms that keeps the tract sterility are urine acidity and various immunological and mucosal barrier. Risk factor specific to women. We have the female anatomy, whereby the woman's urethra is shorter than the man, making it a shorter distance to travel by the bacteria to reach the bladder. Sexual activity. Sexually active women are usually prone to UTI than the non-active counterpart. Certain types of birth control, such as use of spermicidal agent and diaphragm, can increase the risk of UTI. Menopause. After menopause, the estrogen level of a woman's body declines and causes changes to the urinary tract and making it vulnerable to the infection. Other risk factors for UTI include urinary tract abnormalities. Babies who are born with urinary tract abnormalities that does not pass urine normally are at increased risk with UTI. Blockages in the urinary tract, such as kidney stone, enlarged prostate that traps urine in the bladder, can increase the risk of UTI as well. A suppressed immune system, diabetes, and other diseases that impair the immune system can increase the risk of UTI as well. The use of catheter. Patients who are hospitalized and paralyzed patients are usually at an increased risk of UTI because they're using catheter to pass out urine. A recent urinary procedure, patients have undergone recent urinary procedure using the medical instrumentation can increase the risk of UTI as well. Pathogenesis of urinary tract. The first step in the pathogenesis of urinary tract infection is colonization. Pathogens colonizes the periurethral area and ascends through the urethra up to the bladder. Once in the bladder, uroepithelial penetration occurs, whereby fimbria allows cell penetration and cell attachment. Once sufficient bacterial colonization occurs, bacteria may ascend on the ureter towards the kidney. Infection of the renal parenchyma causes an inflammatory response called pyelonephritis. This may lead to interstitial nephritis called the acute kidney injury. So as you can see in the chart, UTI can have adverse effect if it remains untreated. So now I'm going to turn you over to Ms. Yadav for the classification of UTI.
Thank you, Ms. Jen. Good afternoon, everyone. I'm Ras Anyado, and I'm going to discuss the 5 classification of urinary tract infection. First, urethritis. This is defined as the inflammation of urethra, although this condition may result from infectious or non-infection etiologies. Urethritis described as urethral inflammation caused by sexually transmitted disease or STD. Next is cystitis, which represents the bladder mucosal invasion, most often by enteric coliform bacteria. In short, the inflammation of the bladder wall, which it could lead to complication or if untreated. Third, acute urethral renal syndrome characterized by urinary frequency or dysuria and suprapubic discomfort without any objective finding of urological abnormalities. Pain may also be experienced in the lower back, genitals, abdomen, and suprapubic region. Fourth, asymptomatic bacteriuria bacteria in the urine, and in addition, there are also Candidaria described yeast in the urine. The condition simply refers to the detection of a high number of bacteria in a urine sample. They are typically introduced into the urinary tract during intercourse or when wiping after a bowel movement. And last one will be the acute pyelonephritis, or what we call upper urinary tract infection. This happens if the defense mechanism of the lower urinary tract fail. Upper tract or kidney involvement occurs. Host defenses at this level include local leukocyte phagocytosis and renal production of the antibodies that kill bacteria in the presence of complement. And let's proceed to the diagnosis to be discussed by Ms. Sanyata Goton.
Thank you, Ms. Yadaw. Good afternoon, everyone. I'm Sanyata Goton, and I will discuss the diagnosis of the urinary tract infection. UTI can be found out by this procedure: cystoscopic examination. Using a scope inside the bladder. For recurrent UTI, the doctor may perform a cystoscopy using a long thin tube with lens or cystoscope to see what's inside the urethra and the bladder. The cystoscope is inserted into the urethra and passed through the bladder. Microscopic examination of urine. The laboratory analysis of red blood cell, white blood cell, or bacteria that present in the urine. Urinalysis, growing urinary tract bacteria in the laboratory, followed by urine culture. This test, the doctor tells what bacteria is causing the infection, in which medication is the most effective. Imaging techniques, computerized tomography or CT scan, magnetic resonance imaging or MRI. This is to create the image of the urinary tract. The doctor may also use a contrast dye to highlight the structures of the urinary tract. And now let's proceed to the treatment and nursing intervention to be discussed by Ms. Divilia.
Thank you, Ms. Goton. Good afternoon, everyone. I'm Ms. Lovely Divilia, and I will discuss the treatment of urinary tract infection and the nursing intervention. Antibiotics are prescribed for simple UTI. These include amoxicillin, nitrofurantoin, Bactrim, or cephalexin. UTI usually subsides within a few days after the treatment is commenced. However, the completion of a course of antibiotics is necessary to ensure that the infection has been treated fully. Otherwise, there is a chance of a resistant bacteria might grow, which may result the patient having to be hospitalized for administration of intravenous broad spectrum of antibiotics. For recurrent infection caused by sexual activity or the honeymoon cystitis, treatment involves a single dose of prescribed antibiotics to be taken just before or after the sexual intercourse. Treatment option. The doctor may prescribe any of the following treatment options for a woman who has frequent recurrences 3 or more times a year. Low dose of prophylactic antibiotics such as nitrofurantoin on nightly basis for 3 months or longer. If taken at bedtime, the drug remains to the bladder, which may be more effective. Studies at the University of Washington, this shown therapy to be effective without causing any serious side effects. Single dose of appropriate antibiotic before sexual intercourse. Short courses 1 to 2 days when symptoms initially appear. Preventive measure against UTI. Doctor suggests some additional steps that a woman can take care on her own to avoid an infection. Wipe from front to back to prevent the bacteria around the anus to be transported to the vagina or urethra. Avoid using feminine hygiene sprays, scented douches, and bubble bath, which may irritate the urethra. We recommend using water to wash the genital area instead. Cleanse the genital area before sexual intercourse. Diet, drink plenty of water every day. Some doctors suggest drinking of cranberry juice, which in large amounts inhibit the growth of bacteria by acidifying the urine. Vitamin C or the ascorbic acid as a supplement has the same effect. It is best to avoid drinking coffee, alcohol, and eat spicy foods which may aggravate the symptoms. Nursing intervention. Encourage increased fluid 3 to 4 liters a day if tolerated to help improve renal blood flow. Encourage the clients to void 3 to 4 hours to prevent the accumulation of urine, thus limiting the number of bacteria. Assess the patient pattern of elimination. Note client age and gender. Serve as the basis for determining appropriate intervention. Urinary tract infections are more prevalent in women and older men. Palpate the client's bladder every 4 hours to determine the presence of urinary tract retention. Instruct the female client to wipe the area from front to back and the avoidance of bathtub. Proper perineal care help in minimizing the risk of contamination and reinfection. Maintain the acidic environment around the bladder by the use of agents such as vitamin C, mandelamine, a urinary antiseptic when appropriate to prevent the occurrence of bacterial growth. And now I pass to Ms. Abriam for the conclusion of urinary tract infection.
Thank you, Ms. Develia. Good afternoon to everyone. My name is Rogelia Abriam. I will discuss about the conclusion. Conclusion, urinary most infected subjects in the population. Development of resistance to antibiotics by the bacteria result in problems during the treatment and leads to relapse or recurrence. Recent advances such as development of immunological like intranasal vaccine may result in lifetime to cure of the infection. Once again, we are the gold digger and thank you so much for listening in our presentation about urinary tract infection or UTI. Thank you.
Okay, so again, colon cancer group, you can begin. All the best.
Good afternoon, panel. Good afternoon, everyone. I would like to introduce our group. We are Group 2, together as one. Our topic is colon cancer. Colon and rectum is the end of your digestive system, where the foods go down through esophagus, stomach, small intestinal, to colon and rectum. Colon and rectum has a lot in common, so they are often called colorectal cancer. These cells can grow and form an cancerous polyps that could become a cancerous tumor called adenocarcinoma. Most colon and rectum cancer are classified into malignant and benign. Malignant tumor can grow and spread to the other parts of the body, while benign tumor can grow, but it will not spread. The other types of colorectal cancer are less common. The gastrointestinal stromal tumor. This tumor starts into special cells in the wall of the digestive tract, and it could be found anywhere in the digestive tract. The other one is lymphoma. This cancer starts into types of immune cells called lymphocytes. Lymphoma often starts in the vein sites. Next is objectives. To understand the different options and the various types of colorectal cancer, including preventive measures. To understand the early onset and the etiology and pathophysiology of colon cancer. To understand the risk factors and the signs and symptoms of colon cancer. To understand the diagnostic testing and the treatment and prognostic. To understand the current recommendation on colon cancer, including prevention and screening, and the follow-up care for colorectal cancer survivor. Next is definition.
Colon cancer is sometimes called colorectal, which is a term combined. Colon cancer and rectal cancer, also known as bowel cancer or rectal cancer, a malignant tumor arising from the inner wall of the large intestine. Colon polyps, long-lasting standing. Ulcerative colitis. Most colorectal cancer develop from polyps. Adenoma carcinoma, this is the most common type of colon. Abdominoperineal resection. It involves the surgical removal of the anus, rectum, and sigmoid colon. Acetaminophen, drugs that reduce pain and fever. Acute, happens for a short period of time. Adenoma, non-cancerous. Polyps, first step toward colon and rectal cancer. Next is signs and symptoms.
It's important to get checked if you have any of the following problems. A changed bowel habits such as diarrhea, constipation, or narrowing stool that lasts for more than a few days. A feeling that you need to have bowel movement that it's not relieved by having one. A rectal bleeding with bright red blood. A blood in the stool which may look like dark brown or black. Cramping or abdominal belly pain, weakness and fatigue, losing weight without trying, risk factor, older age, African American race, a personal history of colorectal cancer or polyps, inflammatory intestinal condition, chronic inflammatory disease of the colon, inherited syndrome that increase colon cancer risk. The most inherited syndrome that increased colon cancer risk. Family history of colon cancer. You're more likely to develop colon cancer if you have blood relative who has the disease. Low fiber, high fat diet. Some study have found an increased risk of colon cancer who eats diets high in red meat and processed meat. A sedentary lifestyle. People who are inactive are more likely to develop colon cancer. Diabetes. People with diabetes or insulin resistance have an increased risk of colon cancer. Obesity. People who are obese have an increased risk of colon cancer. Smoking. People who are smoke may have an increased risk of colon cancer. Alcohol. Heavy use of alcohol have increased risk of colon cancer. Radiation therapy for cancer. Radiation therapy for cancer directed to the abdomen to treat previous cancer of the colon, to treat previous cancer risk of colon cancer. Lifestyle changes to reduce your risk of colon cancer. Eat variety of fruits and vegetable grains. Choose a variety of fruits and vegetables. Drink alcohol in moderation. Limit the amount of the alcohol. Stop smoking. Quit may work for you. Exercise most of the week. Start slowly and build up gradually to 30 minutes or see doctor first before starting any exercise program. Maintain a healthy weight. Next is pathophysiology.
Colon cancer is a type of cancer that begins in the large intestine. The colon is the final part of the digestive tract. Colon cancer is believed to arise from two types of precursor polyps via two distinct pathways. First is the conventional adenoma. By conventional adenoma, two carcinoma sequence. The conventional adenoma arises from mutation of the ATC gene. Progression to colon cancer is multi-step process. Second is the serrated adenoma to carcinoma theory. The fundamental genetic defect in serrated adenoma is unknown. Anatomy of large intestine. The colon large intestine is the gastrointestinal tract extending from the ceca to the anal canal. Anatomically, the colon divided into four parts: ascending, transverse, sigmoid, and descending colon. Ascending colon is the part of the colon located between from the transverse and ceca. The role of the ascending colon is to absorb the remaining water and other nutrients from the undigestible material, solidifying it to form this food. Transverse colon. Transverse colon is the longest and most movable part of the colon. Sigmoid colon. Sigmoid colon is the last section of the bowel, the part that attacks to the rectum. It's about a foot and half long, around 40 centimeters, and it shapes like a letter S. Descending colon. Descending colon is surfaces that will eventually be end-tied to the rectum. Rectum. The rectum is a straight 8-inch chamber that connect the colons to the anus. The rectum job is to receive stool from the colon. Anus. Anus is the last part of the digestive tract. It is 2-inch long canal consisting of the pelvic floor muscle and the two anal, sphincter, and internal. Ceca and appendix. The ceca is about 6 cm long, extend downwards into the appendix, a winding tubular sac containing lymphoid tissue. Ileocecal bulb. Ileocecal bulb is the sphincter muscle situated at the junctions of the ilia from the colon. Next is diagnosis.
Diagnosis is the first step in developing colorectal treatment plan. Procedure in diagnosing colorectal cancer includes endoscopic procedure, lab tests, biopsies, CT scan, ultrasound, MRI, PET, and barium enema. Endoscopic procedure allow the doctor to examine the inside of the body. This is the colonoscopy, diagnosing the large intestine using the lighted instrument called colonoscope. It is a long flexible tube that inserted to the rectum that has a video camera at the tip that allow the doctor to view the entire colon. Lab tests. Several stool tests are conducted to look for a blood. Biopsies may be critical in helping diagnosing colorectal cancer. CT scan. Scan of the chest, pelvis, and abdomen are performed to determine whether colorectal cancer has spread to the other parts of the body, such as lungs, livers, and other organs. MRI. These tests allow for a greater soft tissue contrast than CT scan. PET, scan of the chest that determine whether colorectal cancer has spread to the lymph nodes or other area of the body. Ultrasound. Procedure may be used to produce images of internal organs to check for tumors. Barium enema. This test used to X-ray the large intestine. It is used when colonoscopy is not an option. Modifiable and non-modifiable risk factors of colorectal cancer includes lack of physical activity, excess weight or obesity, type 2 diabetes, cigarette smoking, moderate or heavy alcohol consumption, certain inherited syndromes such as Lynch syndrome or familial adenomatous polyposis, personal history of high-risk polyps or colon of the rectum, family history of the disease, diet, and age. Next is treatment.
Stages of colon cancer and treatment. Stage 0 and 1 can do surgery. Stage 2 and 3 can do surgery, chemo or biologics, and radiation. Stage 4 can do surgery, chemo or biologics, radiation, and interval radiology. Surgery, removal of polyps and a small amount of inner lining of the colon, resection of the colon with colostomy. Chemotherapy, it kills any cancer cells that remain in the body. Radiation, used to shrink a large cancer before an operation. Targeted drugs like Folvox, leucovorin 5-FU, and oxaliplatin, eloxatin. Folpiri, leucovorin 5-FU, and irinotecan come to
Kindly unmute yourself.
Nursing and intervention. Provide therapeutic care, chemotherapy treatment, radiation therapy, promote skin care, patient to wash the skin gently with mild soap, proper medication, medication prescribed by the physician, balanced nutrition, patient to and high fiber content food, physical activities, mitigation of pain and distress, instruct her or him not to sit long period of time, follow-up checkup, and effective individual coping, provide open and non-judgmental environment using the therapeutic communication skills of active listening. Review past life experience, talk about things that patient interest. Conclusion. As we conclude, colorectal cancer is preventable. Nearly all cases of colorectal cancer develop from polyps. Detection and removal of polyps through colonoscopy reduces the risk of colorectal cancer. Colorectal cancer screening recommendations are based on the medical history and family history. Screening typically starts at the age of 45 in patients with average risk. While it is definitive, there is some evidence that diet may play a significant role for colorectal cancer. Colon and rectal surgeons are expert in surgical and non-surgical treatment of disease of the colon, rectum, and anus. Board-certified colon and rectal surgeons complete residencies in general surgery, colon, and rectal surgery. Patient outcome is strongly associated with colorectal cancer stage at the time of diagnosis. This is one reason why early detection through screening method like colonoscopy is crucial. Follow-up care after treatment for colorectal cancer is important. Undetected cancer cell can remain in the body after treatment. Most patients will have a repeat colonoscopy 1 year after the completion of treatment. Thank you.
Thank you very much. Okay, I will stop recording. So again, welcome to the case presentation of hypertension. Group 3, you can begin.
To our nursing instructor, Dr. Eugene M. Macalina, sir, nursing aid team, panelists, and my fellow classmates, pleasant good afternoon. I'm Alma Dusong, and we are going to present our group thesis called hypertension. What is hypertension? It's another name of high blood pressure. It can lead to severe and increased risk of heart disease, stroke, and sometimes death. Hypertension has often been described as the silent killer. So sit back, enjoy, and hope you will learn something new in our group thesis presentation. And let me call on Miss Irene Bermelo to explain about the objectives. Thank you. Miss Irene Bermelo, please. Can you please on your microphone? Please?
Irene
Bermelo,
please switch on your microphone.
thank you.
Okay, sorry. Objective hypertension describe the demonstrate appropriate technique for the blood pressure assessment, describe the operator and patient factor that artificially raise and lower blood pressure, define how to diagnose hypertension in family practice setting for different patient group, and identify the blood pressure target for the groups. Describe and rules and patient determine blood pressure and 24 hours ambulatory blood pressure assessment and diagnosis and monitoring of STN higher than and normal. Describe effect and hypertension and organs and how to assist patient for this propose the initial diagnosis and work up for patient with the new diagnosis of high blood pressure and determine is there is the secondary cause for hypertension virus initial in hypertension. Define the diagnosis and treatment target for the virus group and patient will be high blood pressure. Pressure treatment plan incorporating non-pharmacologic and pharmacologic option for the patient with the new diagnosis and high blood pressure. Recognize and act hypertension crisis, describe the virus drug classes used to treat high blood pressure and their mechanism for the action side relative cause and pharmacokinetics. Our next presenter to discuss about definition, Ms. Marian Bungag. Thank you.
Hypertension, also known as high or raised blood pressure, is a condition in which the blood vessels have persistently raised pressure. Blood is carried from the heart to all parts of the body in the vessels. Each time the heart beats, it pumps blood into the vessels. Blood pressure is created by the force of blood pushing against the walls of blood vessels, arteries, as it is pumped by the heart. The higher the pressure, the harder the heart has to pump. Hypertension is defined as systolic blood pressure SBP of 140 mmHg or more, or a diastolic blood pressure DBP of 90 mmHg or more, or taking antihypertensive medication. High blood pressure or hypertension is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause a health problem such as heart disease. High blood pressure, also known as hypertension, is a common disease that develops when blood flows through your arteries at higher than normal pressures. Your blood pressure is made up of two numbers, systolic and diastolic. Systolic pressure is the pressure when the ventricles pump blood out of the heart. Diastolic pressure is the pressure between heartbeats when the heart is filling with blood. High blood pressure or HBP or hypertension is when your blood pressure, the force of your blood pushing against the walls of your blood vessels, is consistently too high. May I call Ms. Michelle Alonso to explain about the pathophysiology again? Thank you.
Pathophysiology of hypertension. There is still much uncertainty about the pathophysiology of hypertension. A small number of patients, between 2% and 5%, have an underlying renal or adrenal disease as the cause of the raised blood pressure. In the remainder, however, no clear single identifiable cause is found and their condition is labeled essential hypertension. A number of physiological mechanisms are involved in the maintenance of normal blood pressure, and their derangement may play a part in the development essential of hypertension. Based on the diagram that shows, the illustration shows the depicting effects of arterial pressure. The high blood pressure is a sign that the heart and blood vessels are being overworked. Untreated, the disease can lead atherosclerosis and congestive heart failure or the enlargement of heart. The cardiac output and the peripheral resistance. The cardiac output and the peripheral resistance are the two dominants of arterial pressure. Cardiac output is determined by stroke volume and heart rate. Stroke volume is related to myocardial contractility and the size of the vascular compartment, while the peripheral resistance is determined by functional and anatomic change in small arteries and arterioles. Most patients with essential hypertension have a normal cardiac output but raised peripheral resistance. Peripheral resistance is determined at large arteries or the capillaries but small arterioles, the walls of which contain smooth muscle cells. Contraction of smooth muscle cells is thought to be related to a rise in intracellular calcium concentration, which may explain the vasodilatory effect of drugs that block the calcium channels. Thank you, and may I call on Ms. Beverly Ablong to discuss the signs and symptoms of the hypertension.
Thank you, Ms. Michelle. Good afternoon, everyone. I'm about to discuss my topic on the
We can't hear you.
Sorry, sir. Okay.
Could
Thank
you
you,
repeat
Ms.
that? Yeah.
Michelle. Okay, good afternoon, everyone. I am about to discuss my topic on hypertension, which is signs and symptoms. Hypertension is highly prevalent among aging adults and can lead to coronary artery disease and can lead to diastolic heart failure and other cardiovascular conditions. It is also known to worsen clinical heart failure since high afterload increases the work of the heart, prompting a maladaptive state that is reflected by congestion, fatigue, and edema. Hypertension remains one of the most significant causes of mortality worldwide. It is preventable by medication and lifestyle, which will be discussed later on. Many people will have hypertension, do not notice the symptoms, and may be unaware there is a problem. High blood pressure is largely symptomless, also known or called silent killer, as I mentioned earlier. If you ignore your blood pressure because you think certain symptoms or signs will alert you to the problem, you are taking a dangerous chance with your life. Common symptoms can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. More severe form may exhibit fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. If left untreated, hypertension can cause persistent chest pain, also called angina, heart attacks, heart failure, and an irregular heartbeat, which can lead to a sudden death. There are two types of hypertension. The primary or essential hypertension can be defined as an elevated blood pressure of unknown cause due to cardiovascular risk factors resulting from changes in environmental and lifestyle factors. Another type is the secondary hypertension. It's caused by various toxicities, iatrogenic disease, and congenital disease. To diagnose high blood pressure, a doctor uses a blood pressure monitor. They consider a blood pressure reading to be high if it is 130 over 80 mmHg or above. Multiple high readings suggest that the person has hypertension. Some people, such as those who get very anxious at doctor's appointments, may have high blood pressure at their appointment and normal blood pressure at home. This is called white coat hypertension. There are four stages in hypertension, which is normal. The reading is systolic is less than 120 mmHg and diastolic is less than 80 mmHg. Elevated or prehypertension, this is mild. Systolic is between 120 and 129 mmHg and the diastolic is less than 80 mmHg. Stage 1 is the moderate one. Systolic is between 130 and 139 and diastolic is between 80 and 89 mmHg. Stage 2, severe, this severe. Systolic is at least 140 mmHg and diastolic is at least 90 mmHg. When your high blood pressure is very high, complications can occur if long-term hypertension is not adequately treated. And there is a hypertensive crisis, which is an uncommon and dangerous event. A hypertensive or high blood pressure crisis is when blood pressure rises quickly and severely with readings of 180 over 120 mmHg or greater. And there are two types of high blood pressure crisis, which is the hypertensive urgency if blood pressure is 180 over 120 mmHg or greater, and wait about 5 minutes to try again if you are not experiencing symptoms. Another type is the hypertensive emergency. If blood pressure reading is 180 over 120 mmHg or greater and you are experiencing any other associated symptoms of target organ damage. The consequences of uncontrolled blood pressure in this range can be severe and include stroke, loss of consciousness, memory loss, heart attack, damage to the eyes and kidneys, loss of kidney function, erratic dissection, angina or unstable chest pain, eclampsia, and pulmonary edema, or fluid backup in the lungs. In addition, eclampsia is a severe complication of preeclampsia. It is a rare but serious condition where high blood pressure results in seizures during pregnancy. Preeclampsia, a pregnancy complication characterized by high blood pressure and signs of damage to another organ system. Most often is the liver and kidneys. Kidneys usually begins after 20 weeks of pregnancy whose blood pressure had been normal. Erratic dissection, a serious condition in which a tear occurs in the inner layer of the body's main artery or aorta. Blood rushes through the tear, causing the inner and middle layers of the aorta to split or dissect. If the blood goes through the outside aortic wall, aortic dissection is often deadly. Thank you. And now may I call to Miss Florian for the um,
Diagnosis and treatment.
Diagnosis and treatment. Thank you. Thank you.
I just want to discuss about my topic for the diagnosis and treatment. First, I start for the diagnosis. Prehypertension is a warning sign that you may get high blood pressure in the future. High blood pressure increases your risk of heart attack, stroke, coronary heart disease, heart failure, and kidney failure. There's no cure for high blood pressure, but there's a treatment with diet, lifestyle habits, and medications. We know that starting as low as 115 over 75 mmHg, the risk of heart attack and stroke doubles for every 20-point jump in systolic blood pressure for every 10-point rise in diastolic blood pressure for adults age 40 to 70. What boosts your high blood pressure? You have high blood pressure if the top number is 140 or higher, and if the bottom number is 90 or higher, referred as 140 over 90, for example. And here's how to understand your systolic high blood pressure number. For normal, below 120, elevated 120 and 129. Stage 1 high blood pressure, also called hypertension, 130 and 139. Stage 2 hypertension, 140 or more. Regardless of the patient's age of the stage of hypertension, lifestyle medications are a necessity. Non-pharmacologic treatment may improve hypertension therapy with medications or prevent the need of medications entirely. Losing weight and changing the amount of sodium intake can be very beneficial to elderly. Changing from high sodium to low sodium and reducing body weight by as little as through sensible exercise program. For example, our moderate physical activities, 30 minutes per day, at least 5 times a week, may decrease blood pressure by 5 to 15 mmHg. That's all, and thank you. And may I call for Miss Alma Dusong to present her nursing intervention topic. Thank you.
Nursing intervention, also known as action. What do we need to do? Important and main role being a nursing aid, ABC, or airway, breathing, and circulation. Assess and monitor vital signs, focusing on blood pressure, pulse rate, respiratory rate of the patient. Also, we include temperature. Assess and monitor the color of skin and capillary refill for us to have a baseline of the circulation. Truly check the patient laboratory results, blood counts, ACG, ABG, electrolyte, and cardiac marker. Any abnormalities, report to the nurse on duty or attending physician. Help the patient to plan alternate records of activity and rest. Advise the patient to limit intake food high in sodium and cholesterol. If patient is smoker and usually consume, advise them to stop. Encourage the patient to be vigilant of their intake of maintenance medicine. Educate the significant others that important of discharge planning, particularly diet and exercise on the day-to-day living. Overall, our main purpose is to assist, check, and monitor of any abnormalities that the patient is experiencing subjectively or objectively. Then we do accordingly what is necessary to above mentioned. Always remember, if you see and feel something wrong, once you have done everything above, report immediately to the nurse and attending physician. Constant attention by a good nursing aide may be just as important as the major operation by the surgeon. Now, let me call on Ms. Francisca Tolentino to discuss about the conclusion. Thank you.
It is clear the fact of our hypertension is by reducing blood pressure, values decrease the risk for those people who are in medical conditions or suffering from illness, and large number of deaths related to this heart and blood vessels disease. As our research demonstration, despite new effort to diagnose, contain the disease, more research is needed to develop how medicine that will treat the most consistent strains of hypertension and ease the side effects of current treatment. As side effects of current treatment, as it says, health is well, live and learn. That's all. Thank you. That's our group presentation. Have a nice day, everyone. Thank you.
Thank you very much.
Thank you.
Let me stop the recording. So again, good afternoon. Welcome to our case presentation. And the next group is the diabetes mellitus group. You can begin. All the best. And you have 20 minutes. Thank you.
Good afternoon, everyone. Especially to our panelists. I am Iris Opano from Group 4, and our topic is diabetes mellitus. In general objectives of this topic, the goal of this case study awareness of the diabetes by being a powerful voice to improve education, access the quality care, quality of life, and prevention of complications. Here are the specific objectives. At the end of this research, the learner will be able to distinguish between type 1 and type 2 diabetes and its complications, identify the causes, signs, and symptoms of diabetes, explain briefly the pathology of diabetes mellitus, identify the diagnostic and clinical significance of blood glucose tests, discuss the physical activities that can contribute the primary and secondary prevention of diabetes, know the ways and proper dietary to control diabetes, to educate and share information and management and preventive aspects of diabetes. What is diabetes mellitus? Diabetes mellitus is a chronic disorder of metabolism characterized by a particular or complete deficiency of insulin hormones. It is the common metabolic disease resulting is metabolic adjustment physiology changes in almost areas of the type of type 1 diabetes. Type 1 diabetes, no insulin is produced due to the damage of pancreatic cells. Type 2 diabetes, insulin produced is not enough or not effective. Gestational diabetes. Gestational diabetes need specialized obstetric care to reduce and serious complication of the unborn baby. A rare condition is called diabetes mellitus. Diabetes insipidus. Diabetes insipidus is a related of diabetes. Although it's a similar name, different condition, kidney remove too much fluid of your body. Each type of diabetes has a unique symptoms, cause, the treatments, both genes and environmental factor plays a role in triggering diabetes. The next condition, the next topic will be discussed with to Ms. Christine Dampason.
Switch on your microphone, please. You're still muted.
I'm Christine and I'm discussing about pathophysiology of diabetes. Diabetes is a condition related to the ability and effectiveness of insulin within the body. It is related to the levels of insulin within the body's ability to utilize insulin. The pathophysiology of diabetes is complex and it involves several different hormones like insulin, glucagon, and growth. And in type 1 diabetes is characterized a total lack of insulin and it's thought to be caused by an autoimmune reaction. The body attacks itself by mistake that destroy the cells in the pancreas that make insulin called beta cells. Type 2 diabetes involves resistance of the body's peripheral tissues to the effects of insulin. And the liver is able to manufacture glucose, but there are only limited stores of glycogen in type 1 diabetes. In type 2 diabetes is often milder than type 1 diabetes, but it can still cause major health complications, especially in the tiny blood vessels in the kidney, nerves, and eyes. In type 2 diabetes also raises the risk of heart disease and stroke. Other types of diabetes is the GDM or the gestational diabetes mellitus, which is a condition in which a hormone made by the placenta prevents the body from using insulin effectively, especially in pregnancy of the woman. The peripheral muscle and fat tissues are starved for glucose while glucose is very high in the blood. Glucagon secretion is uncoupled from blood glucose levels, and insulin is important in the regulation of glucagon secretion. The fatty acid molecules are partly taken up by the liver, then incorporated into lipoproteins that increase very low density lipoprotein or the VLDL, and the low density lipoprotein or LDL levels is which is a risk factor for heart disease. A dangerous condition called ketoacidosis can develop if ketone levels are excessively elevated. The only available treatment for this is exogenous. Insulin must be injected in the body. The pathophysiology of type 2 diabetes include three main defects that are the pancreas, liver, and the muscle and fat. And the next topic will be discussed by Ms. Matabang. Ba't wala ako?
We can hear you.
Yes. My topic is about signs and symptoms of type 1 and type 2 diabetes. Type 1 diabetes, your body stops making insulin or makes only a tiny amount.
Bakit wala ako?
In this happens, you need to take insulin to live and to be healthy. Without insulin, glucose cannot get into your cells. Your cells need to burn glucose for energy. Glucose collects in the blood. Over time, high levels of glucose in the blood may hurt your eyes, kidneys, nerves, heart, and blood vessels. Type 1 diabetes begins most often in people under age 30, but it can develop at any age. The symptoms of type 1 diabetes. The symptoms of type 1 diabetes is frequent urination. Patients suffering from diabetes usually visit the toilet more frequently, especially during the night. A healthy person on average urinate 4 times during the day and no more than once a night. Number 2, the increased thirst. Dehydration might also cause dryness of the skin and mouth. Due to frequent urination, diabetes patients become more easily dehydrated and, as a result, more thirsty. Increased appetite and fatigue. If your body doesn't produce enough insulin, or if you are resistant to it, then glucose cannot feed your cells. This causes increased hunger and tiredness. Unexpected weight loss. If the body you consume cannot provide enough energy for your body, it will begin to burn fat and muscle. This can lead to involuntary weight loss. Yes, yeast infection feeds or glucose. This increased blood sugar levels can exaggerate the chance of developing fungal infection, particularly in the genital area. Problems with healing wounds. Sufferers of diabetes may find scratches, braces, or blisters heal more slowly or worsen more quickly. For example, that small blister on your foot may suddenly develop into an ulcer. Number 7, blood pressure. Increased blood sugar level can cause bodily fluid to leak into the lens of the eye. This can lead to the lens swelling, which will blur vision. Problems with achieving an erection. Erectile dysfunction is a common symptom of diabetes in men. The condition can be result of the damaged nerves and blood vessels diabetes causes. Gestational diabetes. Diabetes developed during pregnancy, like types of diabetes, gestational diabetes is how your cells use sugar glucose. Any pregnancy complication is concerning, but there's good news. Expedient moms can help control gestational diabetes by eating healthy food, exercising, and if necessary, taking medication. Controlling blood sugar can prevent a difficult birth and keep you and your baby healthy. And hypoglycemia. Diabetic hypoglycemia occurs when someone with diabetes doesn't have enough sugar, glucose in his or blood. Glucose is main source of fuel for the body and brain, so you can function well if you don't have enough. The next topic is ovarian diabetes.
Sorry. Nakamute. Thank you, Ms. Matabang. My name is Paterna Cobilio. My topic is about diagnosis diabetes. There are several ways to diagnose diabetes. Each way should be repeated on the second day to diagnose diabetes. First, fasting blood sugar test. Fasting means not having anything to eat or drink except water. This test usually done first thing in the morning. The normal result for fasting blood sugar level for someone with diabetes is less than 100 milligram per deciliter or HbA1c 5.7%. Second, oral glucose tolerance test. For this test, you fast overnight and the fasting blood sugar level is measured. Then after 2 hours, the doctor will give you a special sweet drinks. Then in that way, the doctor can tell how your body processes the sugar. The normal result is 6.0 millimole per liter. After 2 hours of glucose load level, less than 7.8 millimole per liter is normal. Third is insulin blood test, also known as fasting test. This test can measure the amount of insulin in the body, also monitor the treatment of abnormal insulin level and insulin resistance. Under 100 milligram per deciliter is normal. Between 100 milligram to 125 milligram per deciliter is pre-diabetes. And the fourth is A1C test. This test is common blood test to diagnose type 1 and type 2 diabetes. The A1C test result reflects for the average level for the past 2 to 3 months. The higher your A1C level, the poorer your blood sugar control and the higher your risk of diabetes. Normal result is 5.7%, and between 5.7 to 6.4% is considered pre-diabetes. And the last is random blood sugar test. This test can check any time of the day if you have severe symptoms of diabetes. It's usually done by pricking the finger to draw a small drop of blood. Normal result is 70 to 100 milligram per deciliter, and diabetes is diagnosed at a blood sugar of greater than equal to 200 milligram per deciliter. And the next topic will be discussed by Ms. Elbano.
Good afternoon, everyone. I'm Miss Parnean Albano. I will be discuss about diabetes complication. Diabetes is a slow killer with no curable treatments. However, the complication can be reduced through proper awareness and timely treatment. There are two main types of complication: micro and macrovascular. Macrovascular is referring to the term of micro involves the issue with macrocirculations, which is the circulatory system itself. And other words, cause the disease and cardiovascular itself. The primary complications of diabetes due to the damage in the small blood vessels include damage to the eye, kidney, and nerves. Damage to the eye is known as diabetic retinopathy. It's caused by the damage of the blood vessels in the retina of the eye and can result gradual vision loss and blindness. Damage in kidney, known as diabetic nephropathy, can lead to tissue scarring, urine, protein loss, and eventually chronic kidney transplant. Damage to the nerves of the body, known as diabetic neuropathy, is the common complication of diabetes. The symptoms can include numbness, tingling, can lead to the tingling pain and altered pain sensations, which can lead to damage the skin of diabetes, such as foot ulcer.
Tapos na.
May include and can be difficult to treat, occasionally requiring amputation. Additionally, proximal diabetic neuropathy can cause painful muscles and wasting weaknesses. 3Ps. Polygapia. Describe excessive hunger. Increase the situations of hunger. Polydipsia. Describe excessive thirst. Increase the blood sugar glucose. Polyuria is the terms of passing more urine. The next topic will be discussed about treatment by Joyce Tanyola.
Thank you, Ms. Fernie Ann. Good afternoon, panelists, and good afternoon, group mates. I'm Jocelyn Tanyola, and my topic is about diabetes treatment. As we know that the primary medications for the diabetes is the insulin, especially for the type 1 diabetes in which the pancreas do not produce insulin at all. So definitely type 1 diabetes is so dependent with the insulin. As a care provider, it is important for us to know the peak hours of every insulin types. Because one way of killing your patient is not giving food during the peak hours. Because during this time, the blood sugar level starts to go down and it requires food because to prevent the risk of the hypoglycemia. Take note that hypoglycemia is more deadly than the hyperglycemia. If your patient sugar level below 70, or if the patient looks clammy, shaky, and pale, you have to give your patient a sugary candy or sugary food or drinks to prevent the serious situation like fainting, confusion, and loss of consciousness. So the four types of insulin is the rapid acting insulin, the short acting insulin, and the intermediate acting insulin, and the long acting insulin. Rapid acting insulin, the peak hours is within 30 to 90 minutes with a duration of 3 to 5 hours. The short acting insulin, the peak hours is within 2 to 4 hours with the duration of 5 to 8 hours. The intermediate acting insulin, the peak hours is within 4 to 12 hours with a duration of 14 hours. And lastly, the long-acting insulin, this type of insulin don't have peak hours. So it requires no food or not dependent to food. And that's all for the insulin. For the type 2 diabetes produce insulin but not enough or not effective, or there's insulin resistance of your body. First thing to do for the treatment of type 2 diabetes is to fix your diet, your exercise, in order to fix the broken receptors of your body. But if the diet and exercise do not work alone, you need to take the oral medications or insulin. For me, the best way of treating diabetes is the natural way, like the diet, exercise, or the lifestyle change. So that's all for my topic, and thank you. Next reporter is Miss Anganay.
No.
Prevention for Miss Fernie Ann.
The next topic will be discussed about prevention. Cut sugar and refined carbs your diet to avoid the foods may help reduce the risk. Exercise regularly to prevent progressions of pre-diabetes. Drink water instead to drink beverage, lose weight if you're overweight or obese, can reduce the risk. Quit or stop smoking. Follow very low carb diet can help keep blood sugar and insulin level. Avoid sedentary behavior. Watch the portion size or to avoid the large portions of the food. Eat the higher fiber diet and uh, eat prevent the spike in blood sugar and insulin. Drink, drink coffee or tea to reduce the risk. Consider taking these natural herbs, curcumin or berberine, to increase the insulin. The next topic will be discuss the prevention is Miss Paterna.
Okay, good afternoon, everyone. This is for diabetes for foot care guidelines. To avoid serious foot problems that could lead result losing your toe, foot, or leg, just follow these guidelines. Inspect your feet daily. You must check if there is any redness, blister, or swelling. And call your doctor if you notice anything. Be gentle when washing your feet. Use soft cloth or sponge. But be very careful when you dry your feet. Dry carefully in between toes. Moisturize your feet, but not moisturize in between toes. This can lead for fungal infection. Cut nails carefully, but do not cut too short. This one can lead for toenails ingrown. Never treat your corns or calluses by yourself, not even putting cream or gel. Ask your doctor for appropriate treatment. Wear clean and dry socks. Use them daily, change them daily. Consider these socks is made specifically for the patient with diabetes. Wear socks to bed, especially the old people, they feel cold at night. So don't use any heating pad or hot water bottle. Shake your shoes before putting it on your feet. Otherwise, you may not know there is something sharpened object inside your shoes. Keep your feet warm and dry. Don't get wet your feet on the snow or in the rain. Consider using antiperspirant on the shoes of your feet. This is help if you have excessive sweating. Never walk barefoot, not even inside your house. Keep wearing shoes or slipper. Take care of your diabetes. Keep your blood sugar under control. Don't smoke. Quit smoking. Get periodic foot exam. Seeing your foot and ankle surgeon on regular basis can help prevent the foot complication for diabetes. Thank you. And the next topic will be discussed by Ms. Anganay.
Hello everyone, I'm Layla Anganay. My topic is about nursing intervention. First, for the nursing intervention, we should have to assess the blood glucose level, monitor for the patient's HbA, that's 1C, monitor, assess for the anxiety, tremor, and for the slurring switch, assess for the foot and for temperature, pulse, and color and sensation, assess the patient's current knowledge and understanding about the prescribed diet, assess the pattern of physical activity, monitor for the sign of hypoglycemia, administer the basal and perennial insulin, teach the patients how to perform glucose monitoring, instruct the patients to avoid beating pads and always wear shoes when walking, monitor urine albumin to serum creatinine for renal failure, instruct the patients to take medication, to take oral medication, instruct the patients to take insulin, and for the main planning, the guide for when, what, and how much to eat to get the nutrition need while keeping the blood glucose level in target range. A good meal plan will consider the goals, taste, and lifestyle as well as the medicine taking. For good meal plans also include more non-starchy vegetables such as broccoli, spinach, and green beans. Include fewer added sugar as white bread, rice, and pasta with less than 2 grams of fiber per serving. And focus on whole meal instead of highly processed foods. For nursing intervention, improves diabetes outcomes can be directed at individual with diabetes. Thank you. Followed by Ms. Opano.
Ako nakamute. Wala lang. Magpas na tayo sa oras. Okay, conclusion.
Sorry, you're muted. Yeah.
I think Opano is there. Opano is there.
Thank you, Ms. Anganay. For the end of this topic about diabetic mellitus, diabetic mellitus affect major organs, including your hearts, blood vessels, nerves, eyes, and kidney. Controlling your blood sugars levels can help prevent this complication. Good management of your diabetes, including using your medicine exactly as your doctor prescribes them. Make smart food choices and being physical active. Always remember one thing. Your body is your temple, and we must learn how to take care of it and treat the body right so that the body can good to us in return. We learn a lot of information about diabetes that we do not know about. Living with a chronic disease is challenging. There are several risk factors and complications that can occur, but it can prevented. The best way to deal with the diabetes is to manage a healthy lifestyle with the support of the family and friends. Thank you, everyone, and good day.
Thank you very much. I will stop the recording.